So we will make this link available to you all later. And let's just get started. So welcome to our Ask an Expert webinar. My name is Emily Coyle with the Montana Association of Healthcare Purchasers. And I will be moderating today's panel discussion. So we are going to start today by introducing our esteemed panelists and then turn things over to Deshane Barnett, the Health Director and Health Officer here in Missoula, to help us set the stage for today's discussion. We will then dive right in to asking our panelists to address some of the more common questions we have been hearing from employers about COVID-19, and then we'll open it up to questions from all of you. So you will be muted during most of this webinar, but if you have a question you would like panelists to address, please go ahead and enter it into the Q&A box. You can see that at the bottom of your screen. There's a little, looks like a chat. We will get as many questions as we have time for, prioritizing those questions that have multiple votes from other attendees. And we may also have time to open it up for live questions, so we may be able to unmute you then. All right, I'll now introduce our panelists. This forward. Okay, we have Deshane Barnett, the Health Director and Health Officer here in Missoula County. Robert Farmer is the Senior Vice President for People Solutions at Clearwater Credit Union. Tessa Keller is an attorney with Garlington Loan and Robinson here in Missoula with expertise in employment law. Dr. Cora Newman is a public health and economic development expert and founder of the nonprofit We Are Montana. And Dr. Lauren Wilson is the Pediatric Inpatient Medical Director at Community Children's and also sees patients at St. Patrick Hospital as well. So thank you all for sharing your time and expertise today. I'm really excited about having such a wonderful group. And Director Barnett, I would like to hand it over to you to kick us off today.
Hey, good afternoon, everybody. Yeah, so well, first of all, for folks who aren't familiar, I took over as Health Director and Health Officer just this last summer. So I've been with the Health Department now for about 6 months. And as this, pandemic has gone on, and we've had, a pre-vaccine environment with the spike, a post-vaccine environment with the spike. As Health Director, I get a lot of employers who are reaching out to me, and they're asking me a lot of questions that are great questions. And some of them delve sort of into very individual, medical cases. Others delve very much into the law, employment law. And so I am not a clinician. I am not an attorney, and I can't answer, a lot of those questions. So what I had mentioned, to Emily in passing is that it would be great if for our employers here in Missoula, they had an opportunity to have a Q&A, to ask all of these burning questions about COVID-19 and have someone who does actually have, a background in employment law, a background in, emergency medicine, be able to answer a lot of those questions. And then obviously from the public health perspective and the health code, everything that happens here locally, and then, also how information and resources translate down from the federal government, to Missoula. I'm happy to answer questions, but really I get asked a lot of questions, especially with, House Bill 720, with the recent OSHA vaccine mandate, the CMS vaccine mandate. I get asked a lot of questions that I want employers to have access to very high quality information about. And I'm hoping that that's what today can really be about, is employers in Missoula get an opportunity to get questions answered, and maybe even some questions that you might not have thought about yet, but you hear somebody else ask that question, and just are able to benefit from hearing those answers. So that was really the thought and intent behind today, and just so excited to be able to be here and support this.
Thanks so much, Director Barnett. And I know that there's you mentioned burning questions, and I think that one of the big questions is really, what is the current legal landscape regarding vaccines, masking, regards, what employers can do. Montana is in a unique situation, given that we do have some laws that differ a little bit from the rest of the country. And we're so lucky to have Tessa here with us today. Tessa, can you provide, really kind of an overview of what the current status is regarding vaccine mandates at the federal, state, and local, say, county level? Oh, it looks like you're muted. Tessa, I think we can hear you now.
Well, that's great timing to have a technical issue.
Thank you.
Okay, you guys can all hear me, see me? Okay, I was cut off there for a second, so I'm not sure what I'm supposed to start off with. General introduction.
So we're just going to do, you can say who you are, and then we're also starting with that first question about the legal status of vaccine mandates, if you can provide that general overview of the legal landscape currently.
Sure, and if for whatever reason my internet decides to be weird at this very inconvenient time, I'll hop off, we'll move to the next person, and I'll just call in.
Okay, great.
But in general, it has been a very, very busy week in the legal landscape related to COVID-19 vaccine mandates. Just really generally speaking, there's two categories of things going on right now. For the federal side of things, there is a federal contractor vaccine mandate. There is a vaccine mandate that pertains to facilities that are regulated by CMS. And that means like hospitals and other types of healthcare providers. And there's a third federal vaccine mandate that pertains to, or that is put out by OSHA, that pertains to employers with 100 or more employees. As of just this morning, all of these federal vaccine mandates have been temporarily enjoined. That's just a fancy way of saying every single one of those three federal vaccine mandates that we just talked about have been officially put on pause. So you'll hear, read in the news, people talking about pause, halt. It means all these federal vaccine mandates are just, for the moment, paused. This has been a very new development, as in like the federal contractor mandate was paused this morning. The CMS mandate was paused nationwide yesterday. It was paused in 10 states on Monday. So this is really rapidly developing. For the time being, all of those federal vaccine mandates.
Can I interrupt you for 1 second? I think
we don't know what's going to happen necessarily. The courts are going to have.
Yeah, I think if you turn off your video, you might get a better connection. Sorry to interrupt.
Okay, I'll try that.
Thank you.
See, now I'm frozen.
We can hear you.
If you can hear me, I'll keep going until you let me know otherwise.
Okay.
So the only thing that Montana employers should be focusing on right now is the state law, House Bill 702.
So I think we might want to just move on for a minute unless and come back once Tessa's connection's a little bit better. Tessa, so we will come back to you momentarily. The next question that I do have is for DeShane. We know right now there's really no shortage in this pandemic of misinformation. And really, I think it'd be really helpful to have a brief overview of the current status of COVID-19 in Missoula County specifically, and then how maybe do we compare to the rest of the country regarding case rates and vaccination status. And now, especially with this new variant, what are you guys anticipating over at the health department in terms of what the next several months are going to look like?
So far in this pandemic, Missoula has run several weeks to a month or more, month or 2 months behind national trends. And so national trends do give us a good indication of what we might expect here in Montana and in Missoula. And so what we saw, with the Delta variant is that, nationally cases spiked, and then cases then began to spike here in Montana and in Missoula. And cases began dipping and leveling off, and we are just now getting to that point, it seems, here in Missoula. So our incidence rate has dropped considerably over the last month. So we've gone from an incidence rate of an average of more than 90 new cases per 100,000 people averaged over 7 days to we are today, that number is at 19. So we've gone from over 90 down to 19. So that means that what we are seeing is absolutely a reduction in cases, which is great. We have seen a real uptick in vaccination, which is also great. So we, over the course of the summer, we were giving out about 400 to 500 vaccine doses a week. We're now giving out on average, about 200 doses a day. So, that's going to help. And then our testing, especially, during the spike when Delta variant was really, raging, our testing was also running at about 150 tests a day. And that has gone down significantly. So it's gone in almost in half. So we're at about 70 tests a day now. And so what we are seeing right now is likely a bit of respite, but not the end. So I'm sure that folks are listening to the news and they've heard about the Omicron variant, and we are absolutely following that, paying attention to that. The challenge with Omicron is that it appears to potentially be much more able to evade the effect of vaccines. So we're going to pay attention to that. And we just had the first US case of Omicron reported today in California. So it is here in the United States. And, what we know is that we are in a global society now. And, as someone, so I was born right here in Missoula, as someone, 40 years ago, if something happened in New York or California, it was never going to make it to Missoula. We can't say that anymore. Unfortunately, we are in a different environment now than we were 40 years ago. And we do expect that the Omicron variant will make its way to Missoula. It's still too early to know exactly what that means, but we are doing everything we can to stay abreast of what that means for our community. That being said, we are doing very well as far as vaccines go, and we are doing very well as far as our reduction in cases at the moment.
Thanks, DeShane. Can you also just give an overview of what the current CDC recommendations are around masking, social distancing, indoor gatherings, and vaccinations and boosters? There's been some news out today regarding this week regarding booster shots. And then also, can you talk a little bit about the resources that are available through Missoula County to employers and the general public?
So the federal government has now authorized booster shots for all adults. So that's 18 and over. They are also currently in the process of reviewing an application to allow booster shots for 16 and 17-year-olds. That has not gone through yet. So every adult 18 and over, regardless of pre-existing conditions, is now eligible to receive a booster if you choose. And the recommendation right now is to get a booster, especially with the holidays. You know, we've just passed Thanksgiving, we've got Christmas coming up, and the holiday season, you know, is a time. One, it's colder weather, so people are gathering indoors, and then two, you know, it's a time to see family and friends, and we're gathering with people who are not necessarily part of our immediate household. And what that's going to do is that's going to really allow for spread. We've seen this every year, way before COVID. Any respiratory virus always spikes up during the holidays, you know, because you've got people gathering in crowds indoors. That being said, you know, it's a little more challenging here in Montana, because it can be cooler. Although today I had my door open because it felt like summer here in Missoula today. But you know, a couple of the best things that you can do are still in line with CDC recommendations, you know, that have been in place for a while now, which is, you know, wear masks if you're going to be indoors. If you're going to have a group gathering together, doing it outside or doing it in a well-ventilated place, you know, maybe you can have a door and window open. I get that's harder and more challenging in Montana. You know, if we do get into a real winter and it's, you know, 20 degrees, you're not going to have your front door open, you know, during Christmas dinner. I get that. But doing everything you can to reduce the spread. And so, and what we are seeing is that we absolutely want people to be sanitizing, but as this virus has mutated and changed, as viruses do, respiratory spread is becoming more common than droplets. So just sanitizing is not enough. Wearing masks and the social distancing, having air filters, you know, HEPA quality, HEPA grade air filters, cleaning the air and making sure that the air is ventilated and moving. That's going to be our best bet to try to reduce spread of COVID at the moment. So wear masks, wash your hands, sanitize, but do everything you can to keep well-ventilated space between you and other people.
Great. Thanks so much, Deshane. It looks like Tessa, you are back. Do you want to?
Okay. Yeah. As if the internet knew exactly when I was supposed to talk or something.
Yeah, of course.
Did you get most of what I said?
We did.
Okay. I left off right where we were talking about all the federal laws are stayed. Stayed means they could become active again, or they could be, the injunction could be made permanent. And so what that means is we're left with compliance with House Bill 702, which is a Montana law that came into being in this most recent legislative session that makes an individual's vaccination status a part of a protected class. In short, you cannot discriminate against employees or treat them differently on the basis of their vaccination status. This state law is directly in conflict with all three of the federal mandates. And if those federal mandates are active again, then that will be an issue, yet another issue for the courts to sort out. But for the meantime, House Bill 702 is what employers should concentrate on.
Great, thanks so much, Tessa. I do have a quick question follow-up for that. What authority do states and cities or counties have any authority at all to mandate, say, masks in their facilities or of customers or employees, or is this just applied to vaccines?
Yeah, so there was also another big change in the legislature, kind of a series of different bills that the purpose was to take decision-making authority away from local healthcare governmental agencies. Two of these were passed and made into law. A couple of them were passed and vetoed by the governor. But the result of the bills that were passed, it really does take a lot of control away from folks like DeShane, who are in these positions in local government, where previously perhaps they had the ability to regulate or mandate things like masks. Now that is no longer an option. So that ability for localities to have their own health professionals make those kinds of decisions and mandates themselves on a local level is not available to them anymore because of the legislation that was passed this past session.
Okay, thank you. Speaking of employers, I'd be curious, Robert, you're an employer of a fairly large organization. Can you share some of the biggest challenges with COVID-19 that you're seeing among employees, or that you're hearing from your colleagues, other folks who work in human resources with employers? And what are some of the ways that you've identified to most effectively address some of these challenges?
Yep, of course. Hi, everyone. Thank you for joining us. In some ways, the biggest challenge kind of depends on the day. But when I think back to my COVID experience, I think there's really been sort of three main challenges, and these are probably similar to other employers on the call. The biggest overall has really just been staffing and scheduling. From day one, we've had a goal of keeping 170 coworkers safe. And so that has created challenges around, how do we handle exposed coworkers, ill coworkers, school and daycare issues, really how do we keep our locations staffed and operational? And I would also include some staff burnout in that challenge of staffing and scheduling. The second challenge is, as everyone knows, the rules, laws, and regulations and everything have constantly been changing. And I think there's a challenge there of just keeping up on it, but also I think it creates some confusion for staff because it's always changing. And then the third one is a relatively new challenge, but managing different viewpoints with things around like House Bill 702 and the OSHA ETS. Coworkers are becoming more vocal about what their personal beliefs are. And finding a way to manage those differences as the credit union tries to sort of research and sort out how to best move forward with the ETS. Some of the ways that we have addressed those challenges, lots and lots of open communication. From day one, we've been very transparent about what we're talking about, what the laws are, what's available, what's not available. At the beginning of COVID, we had a task force that met daily and then turned around and did a memo to staff and then did weekly COVID update, all staff calls. Those have moved to monthly, but still, answering those questions and providing information as it comes up. We've also done a lot of things with flexibility and continue to do that, and flexible with schedules, time off policies, everything. And I really, really think it's been that flexibility that has gotten us through a lot of this. And I have to, also give a shout out to all of our coworkers. They've been flexible as well. And when everyone is flexible together, it just makes everything so easy. And then the third thing that we've done that I think has helped us is a willingness to try new things and think outside of the box at times. So some of the things that we've done, we have helped coworkers access COVID tests. So the credit union purchased a case or two of COVID tests and worked with our attorney to do a disclosure so that, if there was exposure, they had quick access to a home test. We changed our frontline staffing model and have been upskilling our frontline staff. That has helped cover a lot of these open shifts. to keep branches operational. And it also allows us to pay those coworkers who tend to be our lowest paid more than what they were making before, which I think sort of helps with some of that burnout and financial stress. We've also done some bonuses. Everybody got we called it a COVID-free day, where everybody got a day off throughout the year to kind of help with the burnout. And then even have gone as far as to put various committees together to do research and provide resources. So for example, we recently did a committee of just people who were willing to research childcare and daycare resources in our community, and then provide their research to staff. So those things have really helped us navigate and work through this very difficult time.
That's a lot of innovative activity going on there, Robert. Thank you so much for sharing all of that. It's really great to hear that that's taking place here in one of our local businesses. So, you know, Robert brought up an interesting point about making testing available. What if, Tessa, this may be a question for you. What if an employee tests positive for COVID-19? How does the employer handle that in regards to other employees and notifying them about potential exposure, or, you know, while honoring that individual's privacy and confidentiality?
Yeah, so this is a mix of where there's a real overlap between, you know, what Deshane and his folks do and the legal side of things, because we all, as Montanans, enjoy a constitutional right to privacy, and that extends to medical information. And this is almost kind of heightened in the employment context. So this is something employers are always cautious about, sharing information, personal information about their employees. So the suggestion, and this is one thing that hasn't really changed since the outset of the pandemic. The suggestion has been in handling these as an employer has been, you talk to the employee who's reported a COVID exposure or COVID diagnosis and say, who have you been in contact with in whatever time period is applicable, depending on where we are in the pandemic and what the CDC says, and have that employee list out the employees. Then you go to that list of employees and say, you may have been exposed to an employee. You're not naming the employee who's tested positive by name. And that way you're letting everyone be aware. But as you can probably hear me explaining this sounds a lot like contact tracing. Now, legally, employers aren't required to contact trace, but that's certainly something that a lot of employers have stepped up and done that in conjunction with local health authorities in order to provide an additional layer of protection to their employees.
Great, thank you. And Dr. Wilson, I have a question for you regarding you know, what's taking place in our healthcare system right now. I think we've all seen the news. We've heard a lot about the strain on the healthcare system due to COVID-19, and you know, now we're also entering flu season. What are some of the concerns that you and your colleagues in healthcare are having going into the winter, and what are some ways that employers can help mitigate these concerns among their employees and customers if they have a customer base?
Thanks for the question, and thanks for the opportunity to talk on the panel. So overall, the situation in our hospitals right now has started to get a little bit better as far as numbers of COVID patients. As Deshane mentioned, our case rates are down over the last month, and hospitalization lags that a little bit, but we are starting to see a few fewer people in the hospital. We are seeing a lot of people who are sick, not just with COVID, but with other infectious diseases. RSV is a big one that we didn't actually see last winter in children, and a lot of people, their daycares, their kids are getting sick. And we're seeing actually quite a lot of that right now, the amount that we would normally see in a winter season, like in February. We're starting to see the first few cases of flu. So if people aren't vaccinated against flu, it would be a great time to do that now. And we're seeing a lot of people whose care was delayed when hospitals were too full and canceling procedures, and people who are presenting with later stages of illnesses than we normally would see, just because they haven't been able to access care because we've really been strained in our healthcare system. So that contributes to everything being still fairly busy right now, and still some barriers to people getting the healthcare that they need. We're dealing in the healthcare sector with the same issues that Robert mentioned as far as burnout and staffing issues, both with people being sick or with people, having some trauma or some exhaustion from the pace that we've had to keep up in the healthcare sector. And that's kind of everyone across the board, from the people at the front desks to the people providing the care in the ICUs. So what I would say is what we're seeing now in the people who are hospitalized with COVID is the vast majority are still unvaccinated. And if they are hospitalized, we're seeing that those that are unvaccinated are needing ICU care, needing higher levels of care usually than those who are vaccinated. People who are vulnerable are those who are vaccinated but might not be able to mount a good immune response. So someone who's undergoing cancer treatment or has cancer, or is older and maybe not, is able to respond to the vaccine. So those people remain vulnerable. And we are recommending that everyone get a booster. So the guidance on that is everyone over age 18, ideally 6 months out from your second shot, that you get boosted at that point. And what we're doing with the news of Omicron variant is really the same thing that we've been doing all along for Delta. And that's, our more pressing issue at the moment, to be honest. And that's, follow some of the CDC guidelines that Deshane mentioned, and also, get boosted as soon as you can, because that really has a strong positive effect on immunity.
Great, thank you. There's also been a lot of discussion around pandemic fatigue and exhaustion, especially among workers. Robert did mention some things that they're doing to address those, but for employers who may not have resources, similar to those that larger employers may have, I guess this question is for Dr. Newman. This is an area that you have expertise in. What are some resources or tools that are available to support communities, employees, and their families that employers may consider implementing?
I thought I unmuted myself. Thank you, Emily, and thank you for having me today. Thank you to all the other panelists for being here and for everyone tuning in. We know that, speaking of burnout, that people don't have a lot of time, extra time, so it's nice to have so many of you here today. So my background is in public health, and I worked on Ebola, and I've been working over the last 2 years on COVID response, really working at the very local level with healthcare workers, tribes, business owners, really focusing on how to, as we all have, keep our community safe so that we can get back to work, right? And get back to our lives. And one of the major difference between something like Ebola and COVID is the extended period and the multiple variants and mutations, and how this continues to change. And that there are people, employers, health workers, everyone on the front lines of this, actually, which is basically everyone, parents, teachers, we all really are on the front lines of this pandemic, is the many decisions that you have to make. So there is, you said pandemic fatigue, Emily, but it's actually also decision fatigue, especially when there's a changing landscape on the legal front, on the vaccine front, on the different variants, that there is a high and growing rate of burnout. So we have in the early phases of pandemic response, we were really focused on clinical and emergency response. And now we're moving into this very extended emergency period. And one of the things that's become more and more important is managing burnout and managing mental health, not only for employers, but for their extended families, especially with some of the challenges related to childcare, and things that are kind of confounding the challenges that families and employers are facing. And so we have, in our work through We Are Montana, shifted away we're still doing some primary response. We've also shifted quite a bit towards resilience and resilience training and resources. And so one thing that if you haven't been able, as an employer, been able to yourself go through the process of identifying the symptoms of burnout for yourself, but sharing resources with your team, that can be just a really simple and important first step to take, is just to really even understand the symptoms of burnout. They are physical, cognitive, emotional, behavioral, and they can be distressing. One of the things that we hear about from health workers is that they feel numb, right? And as a caregiver, your primary goal is to care. And so when you start to feel numb, almost like a lack of empathy because of burnout, it's distressing. So it adds an additional level of stress to your daily work. For employers, as Robert was mentioning, trying to navigate the differing understandings and opinions and beliefs about COVID, really trying to navigate some of those challenges and tensions among your own team. And so we can share, and I think that Emily, you're going to share it in the follow-up that goes out to participants. We can share some more tools about how to identify burnout in yourself and your team, and then some, pretty basic methods for trying to address them and trying to really kind of fill your own cup again. But that is something that we're seeing hit really hard across employers. And, the impacts are real. Suicide rates or overdose rates in a lot of our states in the US are up like 30%. So another simultaneous emergency. So just, I'm always here to encourage people to pay attention to how you're feeling and how you're doing. Take time if you can to invest in regenerating and resetting, because this is a long haul. This is more than a marathon. This is like a Ironman times 10. So we'll share some of those resources. And I think it's important just to continue to acknowledge it among yourself and your employees.
Thanks, Dr. Newman. That is really important information. I do want to move on to some of the questions that we've been receiving from folks. One that came in early, I think this might be for Tessa. Is there any funding to cover the costs of paying employees sick time when they're out with a potential case of COVID?
Yes. So currently there is not. Just as a brief rundown, near the outset of the pandemic, there was a federal law passed. A lot of you may remember the FFCRA that had a bunch of new acronyms that came with it, including Emergency Paid Sick Leave, EPSL, and Extended Family Medical Leave, EFMLA. Those were kind of monumental pieces of legislation from the federal government, because it was the first time there was any sort of federal paid leave provided ever. Employers had to pay certain amounts for certain COVID-related reasons, and they would be reimbursed via tax credit. So that's how the reimbursement was structured. That program ended it was mandatory up until December of last year, and it continued being mandatory and something that was available to employers to use up until the end of October. I believe it was October of this year. So that's a long story to say, because that has ended, that was the only source of federally required or mandated funding to employers. And since that has ended, I'm not aware of any other state or federal funds for employers providing sick leave. As a quick aside, employers in Montana are not required to provide sick leave, obviously, paid sick leave. Employers are obviously encouraged to do so for a wide variety of reasons. But just from the legal side of things, paid sick leave is not something that is required in the state of Montana.
Thanks, Tessa. Another question that came in, and I think we pretty much addressed this, but just to clarify, can a health department require vaccination as part of employment?
So, I'm guessing, trying to guess from the wording what they mean. So can I, as the health officer in the Missoula City County Health Department, Board of Health, can we require vaccination as a term of employment at a private employer? That is not something that local health departments historically do. So I'll be honest, I've never looked into whether or not that authority exists, because it's just not something that we would do. And it's definitely not something that I'm looking into doing. Historically, and Dr. Newman, Tessa, Lauren can all hop in and correct anything that I say, but traditionally, historically, those kinds of mandates come down usually through federal agencies, sometimes through state agencies, and they're usually connected to something like education or employment, and it's something very specific that agency, either federal or state agency, has authority over. Local health boards historically have not gone out and required any kind of vaccination. That being said, we do have a role to play, and when the federal government says folks need to be vaccinated, we work to make sure that those vaccines are available, both either through our county or that they make it their way to private practitioners. And so we absolutely continue to play that role, and we would do that regardless. Even absent a mandate, we want folks to get vaccinated because we know that's one of the best tools we have to fight this virus. So we're going to continue to make vaccines available, but we have no intention of playing any kind of authoritative role in requiring vaccines as part of employment. If I understand the question correctly.
I think that was the intention, Deshane, what you addressed. I think that was the question that they were trying to get at. Tessa, do you have any more information on that from kind of the legal perspective?
No, I completely agree. And just, I feel like I may have kind of glossed over House Bill 702, our state law. It's helpful to know what that says because it's directly related to what employers can and can't do. So currently, where we have this state law that is the only active law related to vaccines, because those federal issues are currently on pause, you can ask your employees about their vaccination status. That is not prohibited by the law. What the law does prohibit is you treating them differently on the basis of that answer. You can encourage your employees to get vaccinated. So that's another thing, offering small, modest incentives to employees to become vaccinated. That is acceptable under federal law. So to clarify, employers can absolutely encourage, like verbally encourage or in writing, encourage their employees to get vaccinated. Federal law says you can offer these modest incentives too. Whether or not that's okay in Montana is undetermined, but that's something to be aware of too. And so at this stage, the answer, I completely agree with Deshane. No, employers cannot mandate vaccines currently without running afoul of our state law.
Thank you. Another question that came in, what is the feedback on the landscape of COVID regarding the antivirals that likely will be coming soon? Thoughts for us is that vaccine rates will drop with the options of treatment increasing and likely testing going up, as individuals would need this to receive treatment within a period of time prescribed for options. Okay, so any thoughts, Dr. Wilson, Deshane, on the antivirals that may be coming?
I think Dr. Wilson was juggling a couple different things, but
I'm sorry, I was getting a transfer call. I apologize.
that's okay. The question was just about the antivirals, the advances that have been made, are being made, and what impact we think that'll have on vaccines.
So the data on that, there's only preliminary data on, some of those therapies. Actually, we got FDA approval. I think they voted 13-10 to approve one of the first of two that have made the news recently. And I think that's really great news because the efficacy, although it's a little bit of a moving target, seems to be a little higher than some of the tools that we already have, like monoclonals. But I would emphasize that you need treatment early on, even if they work the way we think they're going to work. And so that means you need access to quick testing. You need to be tested. You need to have access to the medication, which, is something that we have no inkling of at this point, how that will roll out. And so the very, very best thing is prevention, 100% better than having to seek treatment, but having tools like that is useful and is something that I see as positive.
And Dr. Wilson or even Dr. Newman might know a little bit more about this, but my knowledge and history with antivirals is that they're very expensive, and they always have been hundreds of dollars or more per pill. Whereas the vaccine we have readily available, and you can come in, to the health department at any time and get a vaccine completely free of charge, versus the very high costs associated with antiviral treatment.
I think they were estimating $700 per dose for this. So it's not cheap at all. And monoclonals are not cheap at all. And the vaccine is free to people who come in and get it. So you should not be charged for that. So that's another argument for why prevention is better, and better for us as a society to prevent illness rather than take our chances with treating it with something that's maybe pretty effective, but not 100%.
Yeah, and one thing that I would just add to that is I think one of the really important things that we see in pandemic response in general and just in emergency response is continuing to help ensure that your, as Robert called his colleagues, everyone he works with is our coworkers, right? Is creating opportunities regularly to share information with your employees, right? To come together, have a forum, answer questions, bring in an expert, make them feel like they are part of this conversation, that you're making these decisions together. You want to know how they feel. You want to know what they think the answers are. Because I think that, especially when there's a lot of conflicting information and maybe, just understanding of these different options, that creates people, sometimes that means people shut down. And what you really want is to create an environment where people feel like they can share without feeling, like there's one right answer, right? It's really a conversation. And so I think as we move through this and things continue to change, what I would add in there is just help everyone feel like they're a part of the solution, that this is not top down. This is something you need to do together, because at the end of the day, you're a community, right? As a business. And this is something that you want to find solutions together. I think one of the things that we found to be really effective in these times of chaos or what can feel like chaos is storytelling. Right. So having people come in and share their story, having experts come in and talk about what it's like at the hospital, or what it's like, whatever it is that's relevant to your community of workers, and really just have people talk and share feedback and feel less tension around this issue, because it is just so fraught right now. So that's another thing that I would like to encourage.
Great, thank you all. One other question for Robert. Have you, as an employer, have you adapted your health plan for your employees in ways to accommodate?
That's a great question. We currently haven't made any changes to the health plan as a result of COVID, but on a regular basis are, keeping track of trends and have that as sort of the top of the list when we evaluate the health plan. But so far we haven't had to.
Okay, great. Well, unless anybody else has any questions from the audience, I will just go over some resources that we do have available, and we will make sure to.
Emily, I have a question.
Oh yeah,
but
please.
I know we
go
only
ahead.
have 10 minutes left, and I know we
That's
can't see the participants, but I am so curious to hear from them. If there are any employers on this call who want to share like their top 1 or 2 challenges, like what's really hitting you hard? What's sort of keeping you up at night? What are you, I guess they would have asked the questions if they had those, but I do hope that if anyone has some insights that you could share with us, that's also really welcome. So just putting that out there.
Yeah, and I think we could unmute somebody if they do want to, raise their hand. We can offer that opportunity now. So if anybody wants to push that button to raise your hand or just let us know, we can, let's see, take care of that. Oh, this is a good question too. While we're waiting for that one, has anyone had any travel related guidelines for staff, such as traveling out of area for state requiring testing to return to work, or traveling for work and testing? I guess that could be for any of the attendees as well as the panelists.
I'll start. We did at first, when COVID first started, we had some travel ban policies. But as the state laws changed, we removed all those. And we did for a while require quarantine for any international travel, but that has stopped as well.
And I reviewed and I looked at a lot of those at the beginning of the pandemic as well. And I mean, kind of like what Deshane was talking about at the beginning, where, you know, normally you might, or a while ago, you might think, oh, there's one case of the new variant in California. That's a long ways away. Things have really changed now. And so you kind of saw that playing out at the beginning of this, the travel restrictions for people who travel. It was initially because they were traveling to places that were more dangerous, had higher incidences of COVID transmission, and you were worried about it bringing back here. Well, there's a high prevalence of COVID transmission in a lot of places now. So COVID is not bound by any geographical area. And so I think, and this is more of I'm not a public health expert, but my understanding is that the travel restrictions are just less effective. And that's why people have stopped using them. I saw a question come in from Stephanie. That's a really good question about, does this have, if an organization wanted to reinstitute one of these travel restrictions or something like that, would that comply with Montana law? Yes, it would, so long as you're instituting it to all employees regardless of their vaccination status. So if you said to employee A who's vaccinated, who's going to a very high, going to any place else, out of state, let's just say, or they're going someplace abroad. If you want to require a test when they come back, if that's your policy for everyone, no matter if they're vaccinated or not, then that you wouldn't have any issues running afoul of that Montana law.
Thanks, Tessa. We just had a comment from Kellyanne, which is really, it's really important. I think COVID burnout is huge. Just when you think it's safe to go in the water, we're hit with something else. Now the new variant, the staff are all getting weary and a bit on each other's nerves with the different views on the subject of COVID. It's hard to find the happy medium between keeping staff and the public safe and happy. And I think Cora and Robert, you both spoke to this. Robert, you have that experience, firsthand with trying to navigate those different viewpoints. Any comments from either of you?
Yeah, I mean, I definitely agree with Kellyanne. The struggle is real. I don't have the magic answer. I wish I had an easy button for that one. For us, it's just making sure that everyone feels heard, and has a safe a place as possible to voice their opinions and concerns, but also, being firm and, being clear that, we do expect you to follow our policies and regarding COVID, like we have a few coworkers who don't want to wear masks anymore, happy to have that conversation, but we are keeping our mask mandate for coworkers in place, so being firm with our safety precautions, but the struggle is real.
Yeah, and I think that they're definitely, that's, kind of why I feel like that's the phase we're in as a collective in trying to manage this, is that managing burnout phase. And so maybe we could do another seminar on burnout and managing it. Maybe that'd be something we could do in the future. I am trying to we're trying to run some of those seminars for different groups around the state. But the other thing you might want to look at, and maybe this is another resource we could send out, is bringing in facilitators to have those conversations, because there is a skill to mediation and almost like conflict resolution that needs to happen among groups, just so that they're heard. But Robert, like you said, you're already exhausted trying to manage it all. So bringing in outside facilitators could be something that is helpful to via in person or available. I see Stephanie, to rural and frontier areas. Absolutely. And so we can definitely share more resources on that, and just encourage you to consider maybe bringing in a facilitator or someone to help you all as teams work through it, because it's a lot.
Thank you. Well, we are 2 minutes to the end of the hour, and I just wanted to share these additional resources really quickly. You can find a ton of information on the Missoula County website. They have links to employer resources, posters you can download, signage, all sorts of information from the CDC and OSHA. The National Alliance of Healthcare Purchaser Coalitions has a whole page of employer COVID-19 resources. I encourage you to visit that site as well. They have videos that they've created in partnership with the CDC to encourage employees to get vaccinated, to answer questions, the common questions about the vaccine, to talk about the safety and efficacy of the vaccine. They're really compelling, short 2 to 3 minute videos that you can, share via email or post on your website. And then they are also having a webinar on December 7th that's going to dive a little deeper into COVID-19 response by employers post mandate, and probably a legal update on that as well. So the Society for Human Resource Management also has a great resource list. The CDC's motivational interviewing guide for some of those questions, that Cora was just addressing regarding, having those difficult conversations. And then, of course, the Substance Abuse and Mental Health Services Administration Burnout Guide, another resource. These are targeted a little bit more to healthcare workers, but given the issue that we are dealing with here, it's pretty relevant to everybody. And I will go ahead and share those resources in a follow-up email to all of you who have attended today. And now, just in closing, I just want to say thank you to our panelists for your time and for your expertise, and for all the work that you are each doing every day directly in this pandemic, to address the pandemic and to help improve people's lives and that of our community. Each one of you is playing a really important role, and it matters. And then I also want to thank all of the attendees for joining us. And you can reach out to me if you have any questions, for any additional questions for any of our panelists, or want to be connected to any resources, and we'll be happy to do that. And so now I will stop the recording and say thank you, and have a wonderful afternoon.
Thank you all.
Thanks, everyone.
Thanks, everyone.
Take care.